firstly like to start off by saying that 1/3 of all types of cancer actually stems its root with nutrition, lifestyle, and your overall health, including your weight throughout your life. And it is one of the most common types of cancers found in women. However, men do not escape it either, because they do have the same breast tissues, and so they can also be involved in breast cancers. However, the ratio is much lower and women are much more likely to get breast cancer. And the survival rate has increased, of course, with time, because we have learned how to firstly diagnose it really early. And so early diagnosis is always a great step in prevention and also treatment. And we have also learned to personalize the treatment according to the person. So every person is different, everyone's body works different, everyone's body reacts different to different things. And so we have learned better as to how to treat each individual. And of course, with time, we have understood the disease much better as well. Now, the symptoms, if any of these symptoms are seen in anybody, then they should definitely have it checked by an oncologist. Having any change in the breast tissue should definitely be taken seriously and be consulted by an oncologist. Also, there are certain things which people might rub it off as saying that that's a dryness of the skin or something, especially when we talk about peeling or scaling, crusting, something like that. That people do think that, okay, I'll just apply a moisturizer, I'll just drink more water. But if you have these things, do not take them lightly and should definitely be checked out. Okay. So the risk factor. First one is just being a female. You can't even change that. You can't even help that. Like, okay, you're a female and you're at risk. However, there are certain risk factors that you can change. For example, when we talk about obesity. So obesity is again closely related to your lifestyle, the food that you eat, the workout, especially people who have lower physical activity. That means they have a more sedentary lifestyle, they have a desk job, they don't have much time to go to the gym or be involved in any kind of sports. They definitely are at risk of being obese, of course, with the lifestyle habits. And also not having a child below the age of 30. That I do not want to get into the discussion, because that is a personal choice. Right? That can differ from me to you, and people can have children at as early as 20 or may choose to have it later in your life as well. Now, starting your menstrual cycle at a younger age, which obviously we do not have a control over. However, girls who do start it below 12 years of age are more likely to have breast cancer risks than those who do it later in life. And even menopause. Menopause started after 55 years of age, which is much older, is actually a risk factor for breast cancer. Okay, does anyone of you know who was the youngest girl to get the menopause? Her age, maybe? No? 11 years. Yeah, 11 years of age. That is basically when they haven't even started their periods properly, and she had started her menopause. And she was undiagnosed for 3 years. So when she turned 13 and she physically started showing symptoms of menopause, which are basically even not well tolerated by older ladies, and she was just a child, so they did her hormonal testing and everything, and it turned out that she was having menopause for the past 3 years, which is quite detrimental. The next risk factor is having the hormone replacement therapies that women do usually have during menopause. There are more natural and more nutrition related solutions to menopause symptoms, and I do understand that sometimes you have such horrid symptoms that you just want to get rid of them and have a pill, or just go through the therapy and just be fine. But including foods that are going to come in the next slides, but including foods that contain soy, because it contains isoflavone, soy isoflavone, which is a very similar hormone to the female hormone estrogen. And with that, it balances out and kind of reduces the symptoms, and it kind of helps. Of course, drinking alcohol and smoking. I think this factor is there in almost all the diseases. If you just stop drinking and smoking, you're going to be much healthier. All right, so what do? We have to do prevention. And today I'm not going to talk about any medication. We're only talking about doing it naturally, all natural, with your foods, with your kitchen. So having a healthy diet. It is extremely important to watch what you eat, because in the end of the day, we are what we eat. We become our food. So it's very important. Having a healthy weight. Now, having a lot of fluctuating weight is not good, because it does trigger some hormones which can lead to having an increased risk of breast cancer and other diseases as well. So having a maintained weight at the lower side is usually a good idea. Physical activity, no matter what type you like, no matter what type you enjoy, but keeping yourself active is extremely important. and of course quitting alcohol and smoking. That's very important. So I have some healthy diets for you guys. How many of you have actually heard of Mediterranean diet? Nobody has heard of Mediterranean diet? Okay. It's a very simple and a very sustainable diet. So a Mediterranean diet is very staple. It basically just avoids all the bad and processed things, right? It is very simple. You can have all the whole grains, vegetables, fruits, nuts, oils, fish even is included. However, red meat is in little smaller amounts or very rarely or very occasionally, because sweets and red meats are very detrimental anyways for your health. So this is actually an overall healthy diet. This diet also helps to reduce inflammation. Inflammation has been closely linked to cancer, and there are papers that say that inflamed areas are more likely to be the spreading point of cancer. So definitely this also avoids inflammation, because this diet is very high in omega-3 fatty acids, which is a anti-inflammatory, a natural anti-inflammatory agent. Another is the plant-based diet. Okay, anyone knows the difference between a plant-based and a vegan diet? No? All right. Okay, so a plant-based diet is a diet that 95% is only based on plants, right? Even the protein is the soy. Soy is an amazing source of protein, and so this diet is based 95% around plants, but rarely you are definitely allowed to have your meats, chicken, poultry, fish, whatever you guys wish to have. But this is mostly just plants. When we talk about a vegan diet is ethically a animal protective diet. So there it comes on your ethics that you don't want to wear anything that comes from animals, you don't want to eat anything that comes from animals, and that's also kind of like an emotion related to animals, that you know, I really love my animals, I don't want to kill them, I don't want to harm them and stuff. So, but this is again a very healthy diet, because having a plant-based diet actually reduces inflammation. It also reduces your risk of cancer, and indirectly or directly it also helps you to maintain a weight and a stable weight. And trust me, these are very sustainable. Okay, intermittent fasting. I'm sure you guys have heard of this one now, of course, yes. So intermittent fasting is something that can have a variation. So intermittent fasting has basically these three types, okay. So it's a fasting diet. You can either have eating windows. So you can have 8 hours of eating window in which you can eat whatever you like, you can have your normal meals, everything. And then for the 16 hours, this includes your sleeping time. You're not going to eat anything that contains calories. So you can have water, you can have black tea without sugar, you can have coffee without sugar, green tea, anything that contains 0 calories is acceptable in this. Now, why is intermittent fasting good for cancer prevention? Is because cancer cells actually have insulin receptors on them, and they have it in more quantities than normal body cells, which means indirectly that cancer cells actually survive on sugar. So when we don't eat for a long period of time, we are in the fasting period, for example, we do not release any insulin because we are not consuming anything that contains calories. And even when we talk about proteins, I don't know how many of you know this, but proteins also release insulin as they are being digested in the body. So they also produce insulin, not only carbohydrates. And so when we are fasting, we are not producing any form of insulin, and so we are kind of stopping their growth. Another form of intermittent fasting, now this one and the next two actually depend on your capacity of controlling your hunger, because the fasting days basically is like, for example, in a week's time, let's say you fast for 48 hours, okay? You have eaten 5 amazing days of food, and then, for example, but do not do it like on the consecutive days. Obviously you'll do it for one whole day. So you'll wake up, you'll only have water, tea till you go to bed. So you're not allowed to eat anything. So it's a 24-hour of fast. You're allowed to have water, you're allowed to have anything that doesn't contain calories, but then again you will be very tired, and when you start off it's not very easy either. And then when we talk about the OMAD diet, it is 1 meal a day diet. This one is rather okay, but you have to make sure that you only consume 1 calorie full meal, and that also needs to be nutritious, not like 1 meal I can have, so I'm going to have McDonald's. No, you have to consume something that contains vegetables, that contains meat, that contains good fats, that has fruits, so you are going to consume a very nutritious meal, and then you're going to go about your day with waters and teas and everything. So intermittent fasting is also amazing. It has actually shown great results for cancer patients also. Otherwise also it's great for reducing the risk of type 2 diabetes, heart diseases, and so on. The alkaline diet. Now, on a pH scale, our body is somewhere around, especially our blood is somewhere around 7.4, 7.3. That is the amount of acidity or basicity that we have, right, in our body. So consuming too much of acidic foods or consuming too much of foods that create an acidic load in our body has actually shown to increase the depressive symptoms in breast cancer survivors. So alkaline diet actually does the opposite of that. It doesn't let our acidic load go high, and it maintains it in a certain level where you have a good balance of acidity and basicity in your body, and so it doesn't allow you to have those depressive symptoms, especially if someone is going through breast cancer. This is overall a quite healthy diet. However, it depends on the person how strict they want to go for it, because there are people who will be like, no, I'm not going to eat anything that causes acidic changes in my body. However, we do have to realize that the body is an ecosystem itself, and it knows how to change its pH, and it knows how to regulate its pH as well. So nothing we eat is permanently going to change our acidity or basicity. However, these foods are amazing, and they will help you to kind of go through the breast cancer easier. Okay. Physical activity, very, very, very important. This does not mean that you have to go to the gym, okay? This means that you can do anything at all that you like. You can go for a swim, you can go for a walk, you can even put on some music and dance. To be very honest, it's amazing. Music has shown to improve mood so much, so why not just do that? And it has shown to relieve symptoms of stress and anxiety, even in cancer patients. And even if you are just a normal person and you're having a low day, why not just go ahead and exercise, pump your blood a little bit, and you're going to feel a whole lot better. Now, that was prevention. Now, what to do if you already have cancer, right? So we have to manage the symptoms. Now, in this, there are so many side effects of cancer or cancer therapies that we do as a treatment. And these are just some of them. So people usually do have poor appetite, or they go through anorexia, which means they go through instant loss of weight and they just don't want to eat anything. They have all these stresses on their mind and they just don't want to eat anything. What is the best thing to do is suggest them to have smaller meals instead of having big meals, because obviously they will not be able to sit and finish anything, and looking at the food they're going to feel like, oh, I'm not going to be able to finish it. So it's better to give them something small, something that is nutrient dense, of course, and something that they can enjoy eating. So you don't only have to give them something small and give them something they can eat, but give them at a time that they feel the best. Surround them with people they love, maybe their friends, they can come over, have a chat, and then allow them to eat. So you have to create an environment in which they feel safe enough to eat, right? The next is vomiting and nausea. Of course, these are going to be the side effects of the treatment, and you have to again take it slowly, and you also have to give them something cold, little bit to sip on, something to keep their throats a little bit, how do you say, like just little, like to allow them to eat something, because they're going to have all of these symptoms and they're not gonna like it. And you have to avoid all the extreme flavors, because they can also trigger nausea. So something extremely sweet, spicy, salty, no. Something that's bland, something that's easy to consume, easy to digest, that's going to be your friend. Now, when we talk about diarrhea and constipation, this will differ from person to person, and constipation might also be a result of not eating properly. When you don't eat enough, you're obviously going to have a lot of issues. So you have to make sure that they contain enough fluids, they consume enough fluids throughout the day, and they follow their medications if they were given any, or they can just go for the natural way and they can have soluble fibers if they're going through diarrhea, and they can have fibrous diets, so they need to have fiberful diets if they're going through constipation. And altered taste and smells. So due to the chemotherapies, usually they do have a lot of altered tastes and smells, so they don't want to eat something that is something they loved. So there was this one case where this man, he used to love eating meat, right? As soon as he started going through therapy, he just hated the taste of meat. He didn't want to see meat in front of him. So obviously his family couldn't feed him any meat because he didn't eat it. And that also can happen in any form, in any food, with any food. They must be loving it before, but they might just hate it during the treatment. So make sure that they have good oral hygiene, so they are not disgusted by their own smells, because that's very important. Second of all, you have to make sure that you use spices. Now, spices don't really add any calories, but they add the flavor. So just making it more palatable Avoiding utensils that are steel is very important because they do give that metallic taste, and then they might not want to eat it. And of course, eating foods at cooler temperature is much better because the flavor kind of mellows down, the smell kind of mellows down, and then you can eat it easier. Okay, so here are some things to avoid just as a preventive measure. Preserved meats. So everyone has eaten hot dogs in here? No? Okay, so any form of preserved meat or deli meat is usually pink inside, right? It's pink on inside. That is due to the preservatives, the nitrate preservatives. And what happens is when we eat them, in our system, they convert into N-nitroso compounds. I know. And those are actually cancer causing, and also they lead to gene mutations, which we all know gene mutation also leads to cancer, and so they're absolutely not good for us. So if you are otherwise generally healthy, having them occasionally is okay, but including them as a everyday life, it's not good. Now, low physical activity levels. You should be active, whether you're trying to prevent cancer or not. You just have to be active, because if you're not active, you're going to create problems for yourself. So that's one of the things. Excess amounts of omega-6 fatty acids. Now, omega-6 fatty acids are something that's present in sunflower oil, safflower oil, and canola oil, and corn oil, and all these things. Now, these are very commonly eaten oils, right? They're edible oils. And it's fine if you consume a little bit of it, because we have to maintain that. It's an essential oil, it's an essential fatty acid, which means we do need it in our body. However, excess of it causes inflammation. And inflammation, as I've said, is directly linked with cancer. So we have to make sure that the ratio between omega-6 and omega-3 fatty acids is correct, and we eat a ratio of at least 1:2 or 1:1 ratio. More of omega-3, of course. Then barbecue. Okay, so when we barbecue a meat, especially on an open flame and especially charcoal, what happens is we create a substance in the meat. It only happens in the meat. We create a substance called polycyclic aromatic hydrocarbons. Okay, it's PAH for short, that's easier. So those are actually cancer causing, and so they are not at all good. So the charred meats and everything, it's actually very bad for us. And of course, high sugar foods, because as I've mentioned, cancer cells do survive off of sugar. So we do need to make sure that sugar content in our diet, especially high sugary foods, is less. And of course, when it comes to preserved meats, barbecue meats and everything, one way of kind of making up for it is consuming a lot of vitamin C, because it is an antioxidant. So if you consume a lot of fresh fruits and vegetables, it kind of balances out, but it's not an excuse to eat all those things. All right, so this is a meal plan that is generally just cancer preventive. However, this is not everything, because I have left one lunch and 2 snacks for you guys to make for me now. Because we have gone through this entire PPT, and I just want you guys to have a look at this. First of all, tell me this: oatmeal with soy milk, berries and seeds. Sounds edible? Yeah? Yeah? You guys can have it for breakfast, it's okay. Oatmeal with berries, or scrambled tofu with spinach and broccoli. You can switch the tofu for eggs even. It's okay, that's normal breakfast, right? And or whole grain toast with peanut butter, right? That's also normal, we all eat it. Okay, what about lunch? Give me some ideas, come on.
Fish?
Fish? Yes, we can add fish, yes. Yeah, we can definitely do that, yeah. Okay, what one form of carb? We have fiber, cool. We have vitamins, minerals, cool. We have vegetables. We have protein, cool. One form of carb also with that, something to balance it out. And then choose 2 snacks. Something that's fun to eat, but it's also not going to cause harm. So no chips and no chocolates.
Dates, yogurt.
Dates, yes, dates and yogurt as well. So yeah, you can have yogurts, you can have dates. With chia, exactly, a chia pudding. So one of the reasons why this is given is because people do have, especially with people who have hyperacidity or who have like ulcers in their stomach and stuff, it is suggested not to directly go for a water, go for a drink when they're eating their meal, and to let their meal go in and settle, and then after some time they can have the water. So that is with respect to that. But when it comes to just normal meals, it depends. If you are actually trying to cut down the amount of food that you eat, you can sip water in the middle of your meal as well. You know, it's just going to take up more space in your stomach, and you're just not going to eat enough in that way. But if someone genuinely has some gastric issues, then it's suggested that they don't drink water right after food. Right. Thank you so much for your question. And I think that the more close you stay to your home, the more easier it's going to be for you to live. So if I am an Indian, I've grown up eating Indian food, Indian style food at least. If you ask me to adapt a meal plan of a Russian, I will not be able to do that. And it will not be sustainable.
My favorite is Calicut, Parangan and all those.
Yeah. Yes, sir, absolutely.
Those blank spaces I wanted to put actually, all these things.
Absolutely, and I must say one thing, that Indian diet is actually very nutritious. We use almost all the spices, right, and in great quantities also, I must say so. So you can stay close to your home food only, but you have to find alternatives. For example, the Mediterranean diet, it's very similar to what we can do, especially a South Indian diet. We can definitely put that into it. We have fish, we have whole grains, so we have rice also, you know, we have all the vegetables also. So I always suggest my clients or my patients to stay as close to home as possible, whatever makes them comfortable, whatever suits their palate, what they have grown up eating, right, and what they can sustain. Because going on a diet is easy, yes, but sustaining a diet is the difficult part, and that's the only thing that's going to show results. So you should always opt for options nearing to your hometown, that's it. But the thing is, with that, everyone reacts differently to foods. Some people genetically, I don't know how, and I'm not one of them, I must say this, wake up hungry and they have the appetite for breakfast. Many people do not have the appetite for breakfast. And so what people like that actually end up doing is intermittent fasting. So they slept for 9-10 hours, whatever, and if they don't eat until lunch, they're having already 14-15 hours of fast. And then they break their fast, and after they go to the gym and then they come back. As long as that lifestyle or that food pattern is not affecting them in any way and is not causing harm to them, it's absolutely fine, because everyone is different. Some people who do enjoy having breakfast and who are genuinely hungry in the morning, they have their breakfast and then they usually will have a very light dinner and very early dinner even. But the people who actually do not eat till lunch, they will be hungry at night. So it works like that. So it's different. Every person reacts differently to everything. You know, the same type of food that I eat and suits me might not suit everyone. So it's very, I feel like food should not constrict people. You know, nutrition is all about liberation. It's all about allowing yourself to nourish the way your body allows it to be nourished. Right? So for me, it doesn't really make any sense. If someone says that, okay, I don't feel hungry in the morning, then I'll start making their plan from the afternoon, from lunch or from dinner or something. And it's absolutely okay.